Nashville is home to one of the best hospitals in the nation. Yet the most recent data shows Davidson is just one of 4 counties that's not experiencing what the feds call a health professional shortage. Good evening, everyone. I'm Rory Johnston.
And I'm Vicki Yates. A shortage of physicians often means greater health disparities and increased incidences of preventable diseases. But News Channel 5's Olivia Michael introduces us to a new program launched by Ascension Saint Thomas and the University of Tennessee to address the physician shortage in rural communities.
Would you consider hydrolysis?
Dr. Thomas Atkins dresses for the job.
If I wear anything else, I can't kind of, work all day.
While staying true to his roots.
People in our community, they would have to choose between, getting a paycheck, going to work, or going to the doctor and taking care of themselves.
His community was a rural town in Cheatham County.
So do you take off work and lose that money for you and your family, or do you just suffer through the sickness?
He hopes his future patients won't have to make that difficult decision.
So when Dr. Glass first contacted me about this position, it kind of checked every box.
The position was a new rural track for family medicine residents like him.
The doctors who go to rural areas often need slightly different training than those who may go to urban or suburban areas.
The goal? To get more doctors.
So you have to know a lot about a lot.
In rural areas.
Physicians in rural areas need to know a lot of different things about a lot of different things.
It's part of a state-funded effort encouraging young doctors to take up rural practice.
The skills that a family doctor or primary care doctor may use may be not to the same depth as in a rural area.
I think that there may be also a fear of having to know all of that information. You're the only physician for miles around, and that's a lot of weight on you.
But Atkins hopes this pilot program will encourage more boots on the ground.
You can really make a big impact in someone's life, and that's very rewarding.
In communities like his. Olivia Michael, News Channel 5.
Thanks, Olivia. According to the Association of American Medical Colleges, 22% of Americans live in rural areas, but only 11% of doctors work in those areas.